My name is Dr. Gibonce Mwakisambwe, working in the Southern Highland Zone at a hospital called Mbeya Zone Referral Hospital, which is a tertiary hospital serving the whole of the Southern Highland Zone, comprising of 7 regions. I happen to be awarded a scholarship in the Postgraduate Diploma in Respiratory Medicine, Merck Foundation Coronavirus Response Program at the University of South Wales in the intake of 2021-2022. So personally, as far as success is concerned, I can say that I have happened to get a well and better understanding as far as respiratory diseases are concerned. In the previous times, my work kept me in the ICU because I have the background of anesthesia and critical care. So we used to have a lot of patients with respiratory diseases themselves, be it asthma or COPDs, and others without that. One way or the other, they will end up into mechanical ventilators needing respiratory support. So with this one, understanding the pathophysiology of the diseases, the trajectories of the disease themselves, it has put me in a better position to serve these patients and increasing their prognosis, making it better, and the outcomes also we see being it better. They don't stay too long as we used to struggle with them in the previous time before I happened to get the cause, and this makes it easier, removing the part of complication due to mechanical ventilation, especially as ventilator-treated pneumonia and any other ventilator-treated events. So I can say these days we see less time of mechanical ventilators because I have happened to get a better understanding of the diseases of respiratory tract or respiratory system after the course. Personally, as career-wise, I can say this is taken as another area of subspecialization, bigger than what I was having before, and in that way it has helped me personally to understand better the disease of respiratory tract system or respiratory medicine. In that way, it means even the outcome of a patient, if I compare from before and now that I happen to get the cause, I can see that the outcome of the patient has been improved, and we don't stay with them too long, especially those who happen to end up into mechanical ventilator needing respiratory support compared to before. So these days they are staying less time, and they are discharged from the ICU, for example, much more earlier with good prognosis, even post ICU discharge. So as far as the cause is concerned, and the country as the country, this is a very new area that is coming up. We did not have people who were subspecializing in this area. As far as to my knowledge, the ones that I know were even less than 10, and mostly they were associated in the national hospital, but in the peripheral hospitals, there were none prior to that. And this is an area that we need massively. Respiratory medicine is an area that we cannot escape, especially for those of us who are staying in the ICUs. And in this way, I could say that it's something that we need, and if possible, we can try to make a special option that people who are in need of this one, who are willing to do this, they should be given priorities to go and subspecialize in this area. In my place, I have talked to my colleagues, we are doing CMEs, we are doing some discussions concerning respiratory medicine as far as the patients are concerned. Whenever we get them, we do that. I have registrars who are very interested in this area, and hopefully maybe some days they will apply and get scholarship and increase the number of specialists who happen to specialize in this subspecialty of respiratory medicine. This is a course that I happen to get under Merck Foundation scholarship, for which I'm sure from where I come from and the cost of the course, without this kind of scholarship, I'm not sure that I would be able to make it. So I will take this chance to say very thank you to Merck Foundation for the great job that they are doing in low-income countries, in Tanzania here in specific, that it's great. You are increasing the number of specialties, you are increasing the number of expertise. These expertise are serving local peoples the way they're supposed to serve them. And I would ask for more favor that, if possible, for people who are applying from our kind of countries, they should be checked into a special kind of an eye to be given some sort of priority so that we can get more subspecialties, not necessarily respiratory medicine, but in other subspecialties that are rare, and still we have those patients in our countries as well, not like they're excluded. and hopefully that we can improve our health and make things better for the population that we are saving. Thank you, Merck Foundation. Hopefully that you keep the great work that you are doing already to make much more impact to as many as doctors as far possible in Tanzania and probably maybe in Africa in general.